May is National Stroke Awareness Month, which means it's a good time to talk about stroke awareness and prevention.
Alyssa Heron explains the signs you should be aware of and treatment options in this week's Medical Moment.
Good morning. Well, Spectrum Health Butterworth is the only comprehensive stroke center in Grand Rapids, treating more stroke patients than any other hospitals in Michigan, and say there's things we can do to treat and prevent a stroke.
These are catastrophic events and very serious, but what is really important to know about them is that they are preventable.
In fact, 80% of strokes are preventable.
Eating a healthy diet full of vegetables and fruits, also exercising. On top of that, making sure that we work closely with our primary care doctor to treat high blood pressure and diabetes, which are strong contributors to strokes. And then one other important thing is smoking cessation. It's really important to stop smoking. That is a clear contributor to strokes.
If you suspect someone may be having a stroke, Dr. Hilda Guerra, a critical care physician with Spectrum Health, says there are some warning signs to look out for.
Typically, with a stroke, you're going to see weakness or paralysis in one half of the body. One of the ways that one can remember stroke symptoms is using the acronym FAST, which stands for face, so facial drooping. A stands for arm, so arm weakness. The S stands for speech changes, and then T stands for time. As I said, time is of the essence. Getting attention immediately when we have a stroke symptom is really important.
The most common strokes are thrombotic and embolic.
One of them is the kind that where blood flow is reduced or stopped in the brain, and it causes brain damage. The other type of stroke is one where there's bleeding into the brain, and that can also cause damage.
That's why it's important to call 911 immediately and get to the nearest comprehensive stroke center like Spectrum Health.
The high volume of stroke patients that we get at Spectrum Health allows us to be the foremost experts in the region for treating serious and complex stroke cases.
And treatments can vary. The most common, clot-busting medication.
What that does is it dissolves the blood clot that's in the brain causing the stroke. The other typical treatment option is a procedure called a thrombectomy. A thrombectomy is a procedure that a physician can do to remove a blood clot from the brain. And what's great about it is that it's a minimally invasive procedure. So it requires a small puncture, typically in the groin, and a small catheter is taken all the way up through the artery of the groin, all the way up to the brain, and that blood clot can be removed. Typically a relatively safe and rapid procedure.
Which can be life-changing.
I have seen patients coming into the hospital being very disabled with their brand new stroke, but they go through this procedure and afterward they only have mild stroke symptoms or are back to normal. So the procedure can really be a lifesaver.